Hello again. In this part, I want to talk about hemostasis. And please don't confuse it with the very similar term homeostasis. The hemostasis is a sequence of responses that stop bleeding when the blood vessels are injured. When the blood vessels are damaged or ruptured, the hemostatic reaction should be very quick, localized to the region of damage, and carefully controlled in order to be effective. We have three different mechanisms for controlling and doing this hemostasis. One of them is called vascular spasm, the other one is platelet plug formation, and the last one is called blood clotting or coagulation. When all of them are successful, they can prevent hemorrhage. Besides this mechanism, we need some clotting factors and the substances which release from our platelets, and they are very important for doing hemostasis. And also we have some factors which are released from the injured tissue, which I will talk about them in this part for you. In this picture, you can see the hemostasis reaction. You see that we have a cut in the wall of the blood vessels. The first happening is called vascular spasm. It means that our blood vessel starts to go to constriction, and by this constriction, it can prevent bleeding. The other mechanism which become active is called platelet plug formation. The platelets come to the site of cut and injury and accumulate here, and by this accumulation they can prevent bleeding. And the last one is called coagulation. The platelet plug which is formed there is very unstable, so we need to stabilize this platelet plug at this site. For this reason, the fibrinogen, which is a protein in our plasma, and its soluble protein become insoluble, and it can make these fibers which you can see between platelet. They can make a mesh or network, and the platelet and the other blood cells can come here and they can completely block the bleeding. And as I told you, when all of them are successful, hemostasis can prevent hemorrhage or bleeding, the loss of large amount of blood from the wall of our blood vessels. Hemostasis can prevent hemorrhage from a smaller blood vessel, but extensive hemorrhage from larger blood vessels needs require some medical intervention. And by clotting, we cannot do anything there. The first part which I want to talk about is called vascular spasm. Vascular spasm means vasoconstriction of the damaged blood vessels. When arteries or arterioles are damaged, the smooth muscle in the wall of these blood vessels contract immediately, a response called vascular spasm. Vascular spasm can reduce blood loss for several minutes to several hours. During this time, the other hemostatic mechanism begin to operate. The spasm is probably caused by the damage to the smooth muscles. It's due to different chemicals which are released by endothelial cells and also platelet, and the other one is pain reflex, which can initiate the vasoconstriction. And the vascular spasm is most effective in smaller blood vessels. When our blood vessels become larger and larger, it cannot do anything specific. After the vascular spasm, we have platelet plug formation. When platelets come into the contact with parts of the damaged blood vessels, their characteristics change and they quickly come together to form a platelet plug, which can help fill the gap in the injured blood vessels. Platelet plug formation has three different steps, as you can see in this picture. In the first step, initially, platelet contact and stick to the part of damaged blood vessels, as you see here, such as collagen fibers of the connective tissue, which is located around the blood vessels here and around the damaged endothelial cells. This process is called platelet adhesion. After that, due to this adhesion, the platelet become active and their characteristic change immediately. They extend many projection, as you see in this picture, from themselves. They make some spikes around themselves, and by this spike, they can attract the other platelets, and they start to release some chemicals. This phase is called platelet release reaction. The chemicals, which I will talk about them in the next slide for you, can help vascular spasm, and also it can help attraction of more and more platelets. And after this platelet becomes spiky and attached to the other platelet and attract more and more platelet here, we have the last phase, which we call it platelet aggregation. The release of platelet chemicals make the other platelets in the area become sticky, and this stickiness helps the other platelets to come. This gathering of platelets is called platelet aggregation. Eventually, the accumulation and attachment of large number of platelets can form a platelet plug, which you can see in this picture. The platelet plug is very effective in preventing blood loss in the small blood vessels, like the vascular spasm. Although initially the platelet plug is loose, it becomes quite tight when we have formation of fibrin fibers. I will talk about it in the third step. A platelet plug can stop blood loss completely if the hole in a blood vessel is not too large. As I told you, the platelets become active when they stop at the site of injury, they become spiky, and they start to release some chemicals. These chemicals are serotonin and thromboxane A2, and these two chemicals can make prolonged vascular spasm. The other chemicals which are secreted are adenosine diphosphate or ADP and thromboxane A2, which attract the other platelet to come there. We have some procoagulant secretion, and they can stimulate coagulation. And after that, we have mitosis, which is stimulated by some of these material, and we have the repair of the blood vessels by mitotic division of the endothelial cells and the smooth muscles, which are located beneath them. If the amount of platelet is less than normal, we have a problem which we call it thrombocytopenia. And when we have thrombocytopenia, most of these phases become a stop or they are not appropriate, and they cannot make a good clot at the site of injury. Platelet plug formation can form very quickly, about 1 minute, but it can prevent from getting too large by prostacyclin secretion by the healthy cells which we have at that site. And after that, we have coagulation. First, the blood is liquid in its form when it's in the large blood vessels. When the blood is become static, it can make a gel-like structure. When it doesn't move, it becomes gel, and then from this gel, the liquid go out and separate. This liquid which come out of the gel is called serum, and you need to know that the serum is very similar to the plasma, just the clotting factor is missed in the serum, which we have it in the plasma. So pay attention, serum and plasma are the same, but in the serum we don't have clotting factor, but in plasma we do have clotting factor. And after that, when the serum go out, the gel is called blood clot. It's a network of insoluble protein and fibers, which we call them fibrin, and they can trap the red blood cells, white blood cells, and platelet inside. And I will show you the picture in the next slide. The coagulation is a cascade of a reaction involving calcium ion and different clotting factor that activate one another. It's a series of reaction, and in this series of reaction, we use different types of clotting factor, and we need vitamin K for making this clotting factor. Vitamin K is very important here. And clotting or coagulation is the series of chemical reaction which can make network of fibrin for us. The clot is in the normal blood vessels is called thrombosis. When our blood vessel is normal, without any injury, without any problem, and we have clot formation, we call it thrombosis, and I will talk about it later for you. If you look at this picture, you can see making fibrin strands. These are the fibrin. The fibrin come from fibrinogen. Fibrinogen is a soluble protein in the blood, and it become insoluble and become fibrin at the time of hemostasis. And you can see that the fibrin become more and more here, and they can trap the red blood cells, and this is the clot. For making a clot, we have three different phases. First, we should make prothrombin activator. It's very important, pay attention. In the first step, we have different mechanisms which can activate our prothrombin. These different pathways are called intrinsic and extrinsic pathway. So intrinsic and extrinsic pathway can activate our prothrombin. After that, the prothrombin activator should convert prothrombin to thrombin. And thrombin catalyze the conversion of fibrinogen to fibrin. Now at the end we have fibrin, and this fibrin strand can trap the red blood cells, and they can make the clot for us. So besides the clotting factor, which we name them by some Roman, let me bring the numerals, we have three different steps. One of these steps is called extrinsic pathway, one of them is called intrinsic pathway, and the other one is called common pathway. The extrinsic pathway occur very rapid, within the second if the trauma is severe. Tissue factor leak into the blood from the outside of the blood vessels. So the extrinsic pathway starts from the external part of our blood vessels. We have release of tissue factors, and these tissue factors can start this pathway for us. It's very quick. After that, we have intrinsic pathway. The intrinsic pathway starts from inside the blood vessels. It's more complex and slower, usually requiring several minutes. The activation happens when we have some chemicals which are in direct contact with the blood, without outside tissue damage or contained within the blood. I will talk about it later for you. And the other pathway is called common pathway. The intrinsic and extrinsic pathway, both of them can help us to have the common pathway. This is the same steps to clot formation once prothrombinase is formed by either pathway. Thrombin has positive feedback effect. Pay attention. Your platelet plug formation and the blood clotting, both of them are positive feedback. In this picture, you can see these two pathways. One of them is extrinsic and the other one is intrinsic. The extrinsic pathway and intrinsic pathway, which will be described shortly, lead to the formation of the active enzyme prothrombinase, which you can see here. Once prothrombinase become active, we have the next steps, which we call it common pathway. The prothrombinase is the enzyme which can convert prothrombin to thrombin. ACE can show you enzyme. When the thrombin is formed, it works as the other enzyme for us, and the thrombin can change fibrinogen to fibrin strand. So, extrinsic pathway from external part of the blood vessels, intrinsic pathway from inside the blood vessels, both of them can help us to have the prothrombinase. When the prothrombinase is formed, the common pathway starts. In the common pathway, we have change of prothrombin to thrombin. After that, the thrombin works as the enzyme and change fibrinogen to fibrin strand. Now I want to talk about each of these pathways in details for you. The intrinsic pathway, which you can see it here, is more complex than extrinsic pathway, and it occurs more slowly, usually requires several minutes. The intrinsic pathway is named because we have some activators in direct contact with the blood or contained within the blood. We don't need any damaged tissue around it. If the endothelial cells which line the blood vessels become rough or damaged, the blood can come in contact with collagen fibers in the connective tissue of the blood vessels. Such contact can activate the clotting factors. In addition, different traumas to endothelial cell can damage the platelet, and the platelet release phospholipid, and this phospholipid which is released from platelet can activate the other clotting factor. After additional reaction, which you can see here, we can activate the prothrombinase. Pay attention. In all of the cascades, in all of the process which we have in our intrinsic pathway, we need, let me draw it for you. We need calcium ion. So pay attention, the calcium ion is very important for our blood clotting. The other pathway is extrinsic pathway. It starts from outside of the blood vessels. We call it because we need a protein, which we call it tissue factor. When we have the injury in the blood vessels, this protein leak from the connective tissue to inside of our blood vessels. And when it comes inside, it can activate the different clotting factor for us. Again, if you pay attention, you can see the calcium ion here. This calcium is very important for activation of prothrombinase for us. And after that, you can see the common pathway. The formation of prothrombinase can start the common pathway. In the second stage of blood clotting, which you can see here, prothrombinase with the aid of calcium ion can catalyze the conversion of prothrombin to thrombin. In the third stage, as you see here, the thrombin can work as the enzyme and change fibrinogen to fibrin strand. And again, in all of this process, we need calcium ion. Thrombin has two positive feedback effects. In the first positive feedback loop, thrombin accelerates the formation of prothrombinase. Prothrombinase, in turn, can accelerate the production of more thrombin and after more and more thrombin. In the second positive feedback loop, thrombin can activate platelets, which can help their aggregation and release of platelet phospholipid. As the positive feedback loop continue, the fibrin clot grow and grow. So the prothrombin activator catalyzes formation of prothrombin to thrombin, and once prothrombin activator forms, the clot forms in 10 to 15 seconds. And as I told you, thrombin can convert soluble fibrinogen to fibrin. Fibrin strands form a structural basis of the clot for us. Fibrin mesh catches the different form element like red blood cells, white blood cells, and the other platelet. And a thrombin, with the aid of calcium ion, can activate one factor, which is factor 13. And this factor can make some cross-link between fibrins, and it can stabilize the clot for us. Once the clot is formed, it plugs the ruptured area of the blood vessel and thus stops blood loss. Clot retraction is the consolidation or tightening of the fibrin clot. Platelet trapped around the fibrin strands, fibrin fibers start to contract, pulling on the fibrin fibers and tightening the clot. Because the fibrin fibers are attached to the damaged surface of the blood vessel, as the clot retracts, it pulls the edges of the damaged blood vessels closer together, and it can decrease the risk of further damage. Permanent repair of the blood vessel can then take place. In time, fibroblasts can make connective tissue in the ruptured area, and new endothelial cells can repair themselves in the lining of our blood vessels. And as I told you before, the vitamin K is needed for normal clot formation. Although it's not directly involved, it's used for making 4 different clotting factors. I repeat this part 3 times for you, so pay attention. The clot elimination includes clot retraction and fibrinolysis. I talked about clot retraction for you, and for clot retraction, we need a protein within the platelet, which we call it actinomyosin. It can contract and squeeze the serum out of the developing clot and making the clot become smaller and smaller. And then we have the other process, which we call it fibrinolysis. When the blood vessels are not damaged, a small clot start to begin and form many times during the day, often at the site of minor roughness inside the blood vessel. I want to draw it for you. Look at here. Imagine that this is a blood vessel, and in these blood vessels, for example, we have deposition of a small amount of cholesterol here. This part of our blood vessel become rough, so we don't have any smoothness in this part. When the smoothness of this part reduce and this part become rough, the platelets come to this side and they can make a plug here. So we have formation of platelet plug in this part. When we have formation of, as I told you, different chemicals are released here and the fibrin strands are created between these clots. So we have a network and our clot become stabilized. This clot, which is created inside the blood vessel is called thrombus. And it's unwanted clot which we have here. And this unwanted clot should be removed. And we have a process in our body which we call it fibrinolysis. The fibrinolysis is the degradation of fibrin strand by the enzyme which we call it plasmin. It begins within 2 days after clot formation, occurs slowly over the number of days, and it can reduce the size of this thrombus and make it smaller and smaller. We don't have plasmin in our blood vessels normally. So we have the enzyme which we call it, we have the enzyme here, I don't remember the name, and this enzyme can change plasminogen into the plasmin. Plasminogen is a protein which we have in our plasma. This plasminogen become activated and it can make plasmin, and then the plasmin can reduce the size of clot for us by degradation and solving the fibrin strand. I told you that inside the blood vessels we may have some deposition and we may have some clot here. When the clot is attached to the wall of the blood vessel, we call it thrombus. When the blood flow is higher than normal and help this clot to detach from the surface of the blood vessels and start to move in our blood vessels, we call it embolus. So when it's attached, we call it thrombus. When it detached, we call it embolus. This embolus is very dangerous for us because this embolus can block the small blood vessels. If it blocks the blood flow in our brain, in our kidney, in our heart, it can make a stroke, kidney failure, heart attack. So it's very dangerous. Sometimes it happens in our lungs and we call it pulmonary embolism. And this pulmonary embolism can make different types of heart failure, and it can make death for us. And you need to know that when we have clot in our blood vessels, the sympathetic nervous system become activated, and this sympathetic response become activated when the blood loss is more than 10%. The sympathetic nervous system increase vasoconstriction, heart rate, force of the heart rate, and force of heart contraction. And it helps the blood to come to our heart and brain more. So it brings the blood from the site of injury to our heart and to our brain. It's effective in maintaining blood pressure until 40% of our blood is lost. When the blood is not at the site of injury that much, that part have enough time to do this different process to making blood clots. I'm done with this part. Let me know if you have any questions.